this idea of 8400 is like no boundary, no hierarchy, no bullshit. So after doing my PhD training in biochemistry and biology in general, I did my postdoctoral fellowship at Harvard Medical School. 99 to 2003 was really a great experience to live a little bit in Boston, except I guess for the winter. But we managed to survive that, but it was wonderful. And then basically from 2003, I returned to the Weizmann Institute, and since then I've been basically assistant professor, associate, now full professor at the Weizmann Institute of Science. But as I said, in recent years, I'm doing more translational research related to heart disease and trying to find new therapeutics for these devastating pathologies. So I would just say that, in really lay language, this organ, the heart, is one of those organs that cannot regenerate. If we have a wound, for example, in our skin, this wound would heal itself, right? Because the skin layer of our body can somehow regenerate. Now, that's not what happens after, for example, after a heart. In a heart attack, a person can lose up to 1 billion cells within such an event. Essentially, 5% of the cells can die within this major event. And the problem that these cells, the remaining cells, cannot divide. So we need to find ways to somehow convince this heart, teach this heart to heal itself. So what we have been doing in the lab is trying to find ways where the heart was still an embryonic heart or very young heart. Where basically, if you would injure an embryonic heart or a very young neonatal, we call it, after birth, it will heal itself, it will regenerate. So in mice, it's been shown very elegantly that on the day of birth, it can regenerate their heart. However, 1 year later, I have to pause 1 second. I have this echo from, I'm hearing myself. This can be fixed somehow. I hear in your computer when I'm talking, so it's like a delay of 1 second or 2 seconds. Oh, it's okay, by the way, but oh, yeah, it just but right now, okay. When I'm like hearing my voice in in a circle, so that's do you think that's necessary? No, no, not you're fine. I hear you loud and clear, and my Wi-Fi is good. But you know what? Let's continue. All right? All right. Let's- So as I said, in mice, it was shown that it is really 1 week after birth that we are losing our regenerative capacity. It will probably be translated in human to 1 year, sort of. So that's really the key challenge because after 1 year, we will not regenerate our organs or our heart. So the rationale was very simple. So let's look at one day old heart compared to 7 days old heart in the mouse and find what is basically lost in this 1 week. And we identified a couple of molecules And one of these molecules, we find that one of these protein that is enriched in a very young heart, but 1 week later is down regulated, it's going down. We show that this can, when we reintroduce it in the adult heart, we can, following heart attack, we can restore heart function, we reduce the scarring of the heart, the pathologies. And that led us to a path, basically a 10 years old path that we started 2015 until now. Basically, we are doing that we translate our basically basic research finding into a models heart repair, and that led us to basically we had to do a large animal experiment in pigs because pigs are more relevant to human health, much more, of course, than mouse heart. And basically in 2021, I founded this startup company. Actually, it's a company based in the US. The goal of this company is to further develop agrin. This is the name of these molecules, towards clinical application in patient with undergoing heart attack or patient with heart failure. This is really the holy grail of our field. Most of our therapies so far aims to prevent the deterioration of the pathology, but not really to regenerate. That's why we call this field regenerative medicine, has been really hot in the last decade because of all this prospect of regenerating tissues, regenerating organ, and perhaps regenerating the entire, health situation. My goal would be, my dream, I would say that, patients come in suffering from, unfortunately, from heart attack, will come into the cath lab in the emergency room, and in the day after, or in the same day, he will get an IV injection into his bloodstream of the protein that we develop, and maybe we'll need another shot 3 days later. But its healing process post this event will be much more beneficial, much more advanced, and better healing from this episode. So that's really my dream. That's what I'm working on. As you probably know, that's been rough 2 years. I do see a little bit of signs of optimism, but still, it's a rough period to raise money. And this preclinical and clinical development requires lots of funding, especially in cardiovascular research. I just want to basically zoom out a little bit. So, as I said, I'm becoming in the last 5 years, I've more call myself entrepreneurial scientist, namely not just thinking about the science, but thinking how we can translate that, how I can push that from the academia to the clinical perspective, but also to the commercial things. So I have started to be kind of talking to a lot of people, to VCs, to pharma, to biotech companies. And that led me basically to found two startup company. One, as I said, about this heart disease, and another one on muscle disease, muscle essentially developing drugs for weight loss. It's not for the weight loss, but one of the side effect of this new band Ozempic and like is that we lost with the muscle mass. We lost a lot of muscle, and that's a big problem. And so my kind of other side of the lab is developing this drug discovery platform to prevent this muscle loss. And but put that aside, I want to go back to this idea of 8400. And so in 2022, I joined this cohort of people. So every year, about 60 or 70 people joined this cohort of 8,400. The idea was to generate 400 people, which will be the basically the network, the healthcare network that push Israel to basically the health technology in the same way that 8,200 did for the, I would say, to the cyber and all this AI stuff. So we wanted to do the same in a biomedicine arena, and that was an amazing experience. First was a very good year in terms of, I think we were all optimistic. It was a post COVID time, and then you are basically in a group joining these activities. We had several activities that ended up with a 1 week in Boston, where I did my postdoc in Boston. So coming back to Boston was real fun for me. But we had a real amazing program at Harvard Business School tailored for 8,400 people. But I want to say that the most striking thing for me in this program was the quality of people that I met there. I knew maybe so first of all, I've thought about this question, and I'm not sure I have, the ultimate answer for that. But first of all, it's the size. Israel is small. It's a small, not just in size, but it's a small in a way that you probably know the people or know a friend of these people, a guy you met in this 8,400. Kind of we are all in the same page that we kind of we know what this guy suddenly the second question you ask somebody, what did you do in the army? Yeah, I know you. So it's a little is I think the army is a sticking point that everyone sort of either knows somebody who was with him in the army, or they have sons in the army or daughters in the army, and so it's a connecting point immediately. But you can compare it to the hub that exists, for example, in Boston, the MIT, Harvard, and all these things, and all these larger biotech environment, or the Silicon Valley. Basically, Israel is that size, so you are small enough, and you are well connected. I say the most amazing part of this 8,400 is not just this 1 year that you're really learning, you're meeting a lot of people, you surface lots of these critical questions. But one simple thing is this WhatsApp group that you need somebody, and within 2 seconds, you have answer for the best surgeon, neurosurgeon, or somebody is wounded in the Gaza war and he needs something. In like a minute, you have all the connection in Israel. If you need somebody to consult with somebody, as an entrepreneur, you want someone to give you an advice. It's like no boundaries. It's like a very friendship and helping environment. Although the army is hierarchical system in a way, but still I found that once in such a group like 8,400, I mean, I get off all my titles. I'm not a professor. I'm just a dad, right? Because everyone is either a professor or a very prestige, I don't know, head of the hospital, or a vice president of a company, or a CEO of this, or so there is no title. It's just a right? And maybe the last thing I can think about is the Israeli nature, kind of the Israeli chutzpah, you could say. The Israelis, it just, I don't know, chutzpah in the context of the good context, because chutzpah can be sometimes, I think the chutzpah in a good context mean that, you know what, I don't give a damn. I would just do it myself. I'm not afraid. I would ask this question. I would go to this person. No boundaries, kind of very direct approach. I need this guy, I would go to him. Because, in the US, you have to be very polite. How you talking, who you talking, how you write. We don't have it, you know? I read it a lot. That, this innovation idea has been has always been there. It's exists in the Israeli nature, but I think it exists in the Jewish world in a way. And you cannot ignore that. So that's exist, but I think that Israel in it is sometimes allows in terms of the size and the people that can push this further. um it's just I would say it was and has been in the right mixture of all these conditions. Having said all that, we have had quite rough 2 years, including the war and everything, which affected all of us in research, in industry, in entrepreneurial. It was very hard. It was very hard. We do feel, I do feel a little bit of improvement. Gaza war seems to be a little bit winding down. We don't really know. We don't have all the hostages back, but there are signs of we are going out of it. And I'm optimistic that maybe now having a regaining of this momentum, I would say, uh, to ignite basically these ideas, this nature of investments and startups and all these. You know what? I've been doing it. I was in Paris for 4 months with my wife, and everywhere I gave talks and met people and researcher mostly, but also some in companies in Paris. Every time I talked about 8400, you saw the people that like really amazed with these ideas, which for us kind of okay, that's what we are. But when you talk to other people, that they didn't really thought about it even. And that's why I started to describe this idea of 8400. It's like no boundary, no hierarchy, no bullshit things. You can reach anyone and get his ideas. You can connect with him, and he will help you. Obviously, yes. Obviously, I want to do that in a way to promote the science, to promote biomedicine, and but also to promote the kind of innovation that comes from our lab, my lab, and but yeah, for the benefit of humankind. That's the idea of 8400, but also my science basically. That's what give me the energy to wake up in the morning and say, yes, I'm doing something important. Sometimes I fail, sometimes it's hard, sometimes it's frustrating, but I know that I have this wonderful question, how you take an organ that cannot repair itself and finding ways to make it younger again and happy again and functioning again. It's a great topic of research, but it also one of the advantages of being at the Weizmann Institute is that we really have our the best students you could imagine. By the way, I compare always our PhD students to postdocs, which are, kind of a more advanced students in other places. Our PhD students, they don't have this, I would say, fear. I can see how they're more mature, they're more, in a way, innovative, energetic. They can reach out to people without being afraid. I think that's what makes Israelis students, when they go out as a postdocs, to be very attractive for researchers at Harvard, at the US, or in Europe, or everywhere else. Hopefully.